I'm joined tonight by Dr. Leah Croll, clinical neurologist and cutting-edge medical expert. Dr. Croll, thanks so much for being here tonight.
Neurologist Dr. Leah Croll is here with more. And Doc, what exactly is inflammation?
So Michael, this sounds like a very catchy term, but it's actually a concept that's been around the medical research world for over 20 years. So I want people to feel empowered by this. I want them to focus on eating healthy. Every day I'm recommending a Mediterranean diet for my patients, and its anti-inflammatory properties are a big part of that. Staying active, managing stress, prioritizing sleep, reducing your alcohol intake, and quitting smoking. Sundowning is really serious. It often requires medication. Multiple people are often involved in managing it and helping patients and their families deal with it on a daily basis. So to conflate sundowning with a poor debate performance just really sort of trivializes what it actually is and how hard it is for patients and their families to have to bear that burden.
It does sound like a mad science experiment, you guys. So basically, this is the concept of using a brain-machine interface to help people. Neuralink is a device that gets implanted within the brain and then reads the electrical signals that our brain cells are constantly sending to one another. And then it can translate those signals into actions outside of the body. In this case, the ability to control a computer or a smartphone. Over 2/3 of women will experience neurologic symptoms with menopause, so this is something I hear from my patients all the time, and I often find them in a place where they're almost questioning the validity of their own experiences. And that's something I think so many of us can relate to. And so I want to start by saying, take it from a neurologist, it's not hysteria. This is real biology. You know, we worry about serious brain injuries beyond concussion. So if someone is really showing that they are losing consciousness, having a seizure, a severe headache, they're nauseous, they're vomiting, those are signs that maybe something more serious has happened, and you should definitely head to the ER if that's the case.
The first thing that you notice is that he's flashing his big Justin Bieber smile at the camera, and certainly he was not able to do that before because of the weakness in the muscles that control smiling.
So I think a lot of companies in the industry are going to start feeling the pressure, and that's sort of what happened with CVS, a major insurance company in California basically took their business away from CVS and towards Mark Cuban's online pharmacy and Amazon's pharmacy.
We have seen lately a lot of celebrities who were healthy professional athletes who had a perfect bill of health and then suddenly they had a cardiac event. So it's not standard, it's not common, but it's also not unheard of to be perfectly healthy and then to learn that you have a heart condition. We're typically going to start by looking at supplements like magnesium or riboflavin, and then we'll get into prescription meds. Some meds are meant to be taken on an as-needed basis to kind of stop a migraine attack in its tracks. Others are meant to be taken on a more regular basis to prevent headaches from happening so frequently.
We don't have a cure for MS, but what we do have are therapies we call disease-modifying therapies. And these are medications that work with the immune system to reduce the frequency and severity of MS attacks.
Well, I'm a huge Wemby fan, so I'm hoping that the rest of his career is safe and secure. You know, the million-dollar question here is what caused this DVT? If a player is developing repeated clots in different types of the body, or there's an underlying provoking factor for blood clots that can't be addressed, then we would worry that they would be at risk for either needing long-term blood thinning medication or having life-threatening clots.
The journey from lab to sort of your local pharmacy shelf is a years-long journey typically for these drugs. It involves multiple rounds of clinical trials, big trials that may take years to execute. So I'd say we're looking at least a couple of years.
All right, Dr. Croll, thanks for breaking it down for us.
Thank you.
That's such great analysis, balance, pros and cons. Dr. Leah Croll, thank you so much.
It is fascinating. Thank you.
Thank you.